Hey everybody, it's Stephanie. All right, so let's get down to it. The last time I talked to you guys, I had an opening under my right boob on the incision where I had, if you're just tuning in and you've never seen my other videos, I had gastric bypass November 18th, 2009. So I am a little over 2 years post-op. I've lost 133 pounds, which puts me at roughly 127 to 130 pounds. I fluctuate 3 pounds, usually nothing more. Not usually, never anything more than that. I've never really gone over 130, so except for maybe like a 0.1 or something. That doesn't really count. But anyway, so I'm hearing things, sorry. So I'm doing an update because I recently, on November 10th, went in for a breast augmentation and a lollipop lift. So basically they made incisions completely around my nipples and then straight down, and then there's like a hole, like a little tiny small incision right underneath my boobs. And to be honest with you, it hurt like you wouldn't believe. So it was actually worse, in my opinion, than my actual gastric bypass surgery. However, after giving it some thought, I did realize that I was not put on a instant morphine IV after breast augmentation and lift. I was sent home with a bottle of Vicodin and whatever was left in me from the anesthesia, and it hurt so bad. However, after having gastric bypass surgery, I was immediately put on a morphine drip. So that could be the reason why the gastric bypass didn't seem to hurt as much to me. So I had saline implants. They are the saline implants with the silicone shell, and I had 480 cc's put in on each side, bringing me roughly to about a D or a double D, depending on how tight my muscles want to hold it down. It was under my muscles, so it was a lot more painful than just going above the muscle, of course. Let's see, what else? So after having... Sorry, you guys can probably hear that there's a car outside honking or something. So after having my breast augmentation and lift, I was, like all my other surgeries, struggling a little bit. I have sutures in that are dissolvable, but for some reason, it happens occasionally. You get what's called suture spitting, which is basically where the knot that the suture, like, you know, the knot where they put in, whatever, the knot, becomes too hard to break down. Like, your body can't break it down, even though it's dissolvable. Because it's a knot right there, there's too much to break down, so your body cannot break it down, and therefore it pushes it to the surface of your skin. So you basically have a little knot and a stitch that's sticking out, poking and snagging on things. And I had 0 on my left side that were doing that, but apparently my right boob has had all the issues that there could be. I'm guessing it's probably just because I'm right-handed and I use my muscle on that side more, and it just pushes, and I don't know, but I had an opening that was split open on the bottom where my incision was. Apparently that had opened up a little bit, and now it's the size of a dime, roughly. It might be a little bit smaller, but not by much. And my husband has to, like, every other day, he has to put in, he has to put in this gauze stuff. It's a calcium, like, seaweed type stuff. It's made from seaweed. Doesn't look like seaweed, though. It looks like a regular gauze. But there's little pieces that are cut, and he has to take, like, tweezers, and obviously we have to clean them up really good and clean it off, and it's really gross, but he has to shove as much in there as he can possibly fit without it, you know, pulling it open anymore, because it has to dry out so that it can heal from the inside out. Now, the other day when I looked at it, I was seriously freaking out because it had gotten bigger and deeper. And since then, we were changing it out every 2 to 3 days. And my husband was just saying, okay, that doesn't look right. That just seems like it's getting worse. I think we need to change it out much more often than every 2 to 3 days. Let's change it like every other day. So we started changing it out every other day, and I think that's helping it dry out a little. And because by the time 3 days rolls around, it's like soiled and the blood has soaked in on it, and it's just mushy. It's really not serving the purpose of drying it out in there. So I don't see how it can really heal if it's always constantly wet. So, sorry guys. So we started changing it out like every other day. And today when he went to go change it out, I was like, oh, thank goodness, it is. You guys can probably hear that. Hey, you want to leave that alone for right now? Just right now? We got our dog. Okay, well, I bought this thing on TV. It's like the As Seen on TV thing. It's called a Shed Pal. Because we have a German Shepherd and she sheds like there's no tomorrow. And I'm not trying to get too much off subject. But anyway, it came with one of those little unstuffed little long toys that has squeakers in it. Apparently, she likes to find the squeaker and squeak it all through the entire house. And as though I don't know she's there. Like I hear her doing it constantly. But anyway. So anyhow, I looked at it this morning, my incision, and oh my gosh, you guys, sorry. This is like the start of my evening before I like start working, and I always get tired right about now. I don't know why. But no, go on. Anyway, so it's looking a lot better, basically. The hole is closing up. Not closing on the outside, but I can see that the inside has gotten less deep. So it's shortening in the depth of it. So that's good. I go back in tomorrow. But on a different note, the other day was the first day that I was able to wear any type of clothing at all as far as tops go that were like fitting. Because before, my boobs were seriously like way out to here. They still are a little bit, but not as bad. But they were so bad, it was to the point where I looked really weird. So anyway, they're starting to drop. My right is of course higher than my left still, so I'm constantly like pushing. But I'm kind of afraid to push too much because I'm thinking, okay, if there's an opening on the under portion of the inframammary fold or whatever of my boob, and I'm pushing down, does not make it want to push open more. But the surgeon's assistant keeps telling me no, it's fine, but I can feel it when I do it. It hurts. Hey, you need to go lay down. You're being too obnoxious over here. People can't even probably hear me. They just hear you squeaking. No, don't you get pushy. She started pushing my hand around. Anyway, so this is really, really, really weird. Okay, to me. So I went with my sister yesterday to the mall, and for the first time I wore skinny jeans. I've never worn skinny jeans in my life. And now that they're in, I had bought some boots that are so cute, but they're like knee-high boots, and they're heels. They have heels on them, so they're nice. And I wore those on top of my skinny jeans, and then I wore like a long-sleeved, nice dressy top that was like form-fitting, you know. Anyway, we're in the car and we're driving back to my sister's house, and she's like, I really don't know how to tell you this without upsetting you or making you think that I'm trying to be like, I'm not trying to be rude when I say this, but hey, stop. But she's like, you look really skinny, like too skinny, like unhealthily skinny. And I didn't even respond at first because I was just kind of like, really? Like, I don't see that I'm so skinny that I'm unhealthily skinny. I see that I'm 130 pounds. I'm 5'4", almost 5'5", and I feel fine. Like, I feel like I look great. I don't think I'm too thin, but she said it could have also been the clothes that I was wearing, so they were extremely, like, form-fitting and tight, so might have made me look a lot thinner. But even so, it's like, gosh, I didn't know what to say, so I just said, I said to her, well, I really don't know what else to do. I mean, I don't want to eat to the point that I gain weight, because then I'll just be right back where I was. But I eat till I'm full, and then I stop. But there's nothing I can do about it. If I lose the weight, I lose the weight. It comes off. I can't do anything about it. I can eat more frequently and hope that I stay maintaining, but I don't want to gain weight. And if people think I look unhealthy, I really don't care. I mean, I don't think I look unhealthy. I think if I gained 5 pounds, okay. If I gained 10 pounds, I'd still look normal. But I don't want to be anything over 140. And I feel like if I keep this 10-pound cushion there, sort of, that if I did gain 10 pounds, I wouldn't look awful. I would still be thin. But I like being 130. 130 was the goal I was going for. And I'm sorry, it's hard, because you go from people saying you're way too overweight, unhealthily overweight. So you get this extreme surgery to make yourself feel better about yourself, to be able to lose the weight, because you can't lose it any other way. And you work really hard to lose the weight. And then when you don't try anymore, you're still losing weight. And then you start hearing, now you're too thin. So it's like, nobody's happy. I'm not upset with my sister, because I know that she means well. She just wanted to tell me, hey, if you're trying, I think she was just trying to say, if you're trying to lose weight, still stop. Because you're too unhealthy looking right now, as thin as you are. So I don't know. What are you guys' thoughts on that? I mean, have you been told that before after gastric bypass? I mean, never, ever, ever has it occurred to me that being skinny was a bad thing, and being thin was a bad thing. And now I'm feeling like people are calling me too thin and saying that I'm too skinny. And I asked my husband, because he's very honest to a fault sometimes, but he doesn't try to like hurt your feelings. He won't tell you unless you ask, but I know that he would prefer me to have a little bit more weight on, just so that I'm not so thin, because he's worried about me as well. But I was like, so do you think I'm too thin? And he's like, I don't know. And I said, okay, seriously, I know you want to tell me. And he's like, well, I mean, you could gain a few pounds and it'd still look fine. I mean, you would be fine. I think you would look good if you gained a little bit more, but it is not my choice, is basically what he said. I am not the deciding factor in what makes you feel good. So if you feel good at 130, then stay at 130. And I'll like you no matter what. So, I don't know. Anyways, what's your guys' thoughts on this? Alright, I am going to let you guys go. Oh, have a Merry Christmas and a Happy New Year if I don't talk to you before then. Hopefully I do, but I got a busy schedule, so we'll see. Alright, bye guys.